How do you tackle the mindset of an obese person to shift them away from maybe emotional eating, from all these triggers and all of that? What do you do?
Okay, so thank you again. So what I would do, first of all, so an initial evaluation is what I do from the beginning for every patient. So that initial evaluation is me trying to understand that life history of theirs and see, what led up to the emotional eating in the first place. And then identify those core beliefs. We call them core beliefs, very fundamental beliefs about themselves, intermediate beliefs, not so deeply held onto, and then the automatic thoughts, which are the things that come into their mind when they are faced with a situation where they need to eat. So once you identify those beliefs, remember they're beliefs, they're not necessarily facts. I teach them, I do it myself, and then I teach them how to look at these thoughts, first of all, to question them, and not to, just because you think them, you believe that they're true, because a lot of us think that, it comes from me, it must be a fact. No. A lot of things we think are, skewed negatively and not necessarily realistic. So I teach them to question their thoughts. I teach them to evaluate their thoughts, which means check it out. Is it a fact or is it more of an opinion? So after this, apart from this skill, I also teach them how to manage their eating. So it's amazing because CBT, can be amenable to weight loss. So I'll give you some, strategies I tell my patients. So number one, identify the goals you have for weight loss. What is it that you will achieve once you lose weight? Is there maybe some outfit you fit into? Is there some activity that you haven't done that you will now be able to do as a result of losing weight? Or is it purely because of your health, as we've been discussing? So whatever your goal for weight loss, put that always at the forefront of your mind. I actually have them imagine it. So the imagination is very powerful, even more powerful than the thoughts you have. When you think in pictures, it holds more true to you than the words. So put that into a picture. Put that picture where you see it every day. It will be like, the prize, and it will be you running for the prize. Next thing I would say is eat slowly. Savor your food. Don't eat when you're engaged in a very interesting conversation with someone, because then you eat and you're not mindful that you're eating. So eat slowly, savor your food. The next thing I would say is identify, when we're identifying those thoughts that led to the emotional eating, respond to them, and then have this response, response card, go through it every day. For example, the one I told you of, I've been stressed, I deserve an extra slice of cake. It's been a hard day. Plus, I've blown my diet. Might as well.
Yeah,
and then you splurge.
Yeah.
And this idea of this diet is too difficult. Now only me.
Yes,
they suffer for this world.
Yes,
those kind of thoughts give you
permission.
Exactly. Now you're talking. So respond to those thoughts. For example, when this common one of I've blown my diet, that I'm no longer on the diet, I might as well. I use this analogy. I say, okay, so because you ate this and that you ought not to have eaten as per your diet, so you decided to blow it. I'm like, yeah, there's no point. So I'll give the analogy. I say, if you are walking down the stairs and you miss your step, do you now throw yourself down the staircase? Yeah, right. You will just take the step, the next step, and keep going. So just because you've made a mistake in your diet, it doesn't mean it's ruined. It's, in fact, a mistake in your diet is an opportunity for us to fine-tune these strategies, to adapt them to you, and even make them more powerful going forward. Another thing I like to do is I teach people to think of what is worthwhile about losing weight. For example, during the times when you did have control over your eating, how did it feel? How did you praise yourself? The
new clothes you could wear, the compliments people were giving you.
Exactly. So that would get you moving when the going gets tough. Another thing I like to remind them, because some people are really scared of hunger pangs. They imagine that, I'm weak, I can't resist food. When the hunger pangs are there, I'll just...
the common one I even get, I have ulcer. So because someone told you have, and they don't have, many people, they don't have ulcer.
Yeah.
So you begin to eat say outside. There's no ulcer
protect yourself from the ulcer pain. Right. So I teach them a small experiment. So if when you have severe hunger pangs or severe discomfort is like surgery, for anybody who has had surgery, if I hadn't had surgery, then maybe broken a bone, that's severe discomfort, right? Then moderate discomfort might be maybe a migraine. Then low discomfort might be maybe some mild stomach pain. Where would you rate hunger pangs? So most people will say, oh, it's mild, it's not that bad. So when the hunger pangs come, try and don't eat and see whether it ever progresses to moderate or severe. A lot of times it never does. And a lot of times it goes to a peak and then it disappears, especially when you focus your mind on something else. So the hunger pangs will not kill you. Definitely. As long as, there's this feeling of wanting to prevent, the hunger is terrible to give me this and that and that. So that's something else I do. Then finally, I remind them that staying away from not eating as per your diet and consistently acting according to your diet is like a muscle. And every time you work in the service of this diet, you build that muscle. So even though it might look as though, are you the only one suffering and all that, you're actually, increasing the likelihood that you will not eat this thing next time. And the more you do it, the easier it is. Definitely. And if you should make a mistake in your diet, give yourself credit for the times you've stood up, handled the diet, and then talk to yourself compassionately. Nobody kicks someone who's already down. Rather, you encourage and you're like, oh, you can try again tomorrow. Yeah. So these are some strategies that you can adopt that would help you to stick to your diet and then do other things.
Right. Like you said, if you make a mistake, most people don't really like eating 2 shawarmas in a day. What happens is that there's just a limit to what the body can absorb. Even if you eat 10 shawarmas, you eat 10,000 calories, your body will still dump most of it. It is when it becomes long-term, consistent, that is when the weight gain happens. And last but not the least, Dr. Anireto, is, you see, CBT is like an established way of taking care of people with obesity. We've patronized you like a few times, especially for people who have weight regain. What problem do you see in your field that you think is limiting the public acceptance of this? Why are you not really like having a crowd of people coming to you, obese people coming to you? Because obviously sometimes even if you do bariatric surgery from people, and I tell people bariatric surgery is not a magic bullet, people do bariatric surgery and still regain the weight. If one does not tackle the fundamental problem, for example emotional eating, childhood trauma, the weight is going to be just a matter of time. So what in your own opinion do you feel as to the slow uptake of CBT in the management of bariatric patients?
Excellent question, and thank you. So people don't believe CBT works. People say, does it work? I've had a discussion with the doctor and like, does it really tell me, like between the two of us, tell me, does it work?
You're not using a knife to cut into your brain.
So I think it's just the not understanding what it's all about. And even if it works, how does it work? How is it that talking to people, you would get them to, maybe not kill themselves for those that are suicidal, or you reduce this terrible mood for those that are depressed or anxiety. So let me answer those questions. So the ways antidepressants and drugs for anxiety work is the same thing CBT does in the brain of those that go to therapy. It increases the level of these hormones that are low, serotonin and dopamine. That's exactly what CBT does. In fact, CBT is the first line now for some anxiety disorders, especially things like panic disorder. How it works is that so if you are anxious, your emotions are high, and when your emotions are high, your ability to reason logically reduces and your thinking becomes more extreme. So having a conversation, if the person is intentionally emotional, of course you have to use techniques to help the person to regulate themselves before you start doing the techniques, the cognitive techniques. But once you've done that, so I'm not arguing with you. I'm not trying to convince you in therapy. We're basically on the same side. I'm guiding you. So there's a concept called guided discovery. I'm showing you, another way to look at it. So I'm laying the options in front of you and saying, in a questioning way. So I'm saying, what do you think would happen if you kept, for example, if you kept on thinking about ending your life? What are the downsides of this? Or what are the advantages? And then if you allow me to use an example of suicide, people would say, the pain would stop. I would leave this world. I'll be at peace. And then I would say, but what if I told you that there's a way you can be at peace and have the pain stop and still be able to achieve your goals because you're still alive? And they're like, oh, really? And I'm like, oh, that's what this is all about. So that is the approach of CBT. It's not persuasion. It's not reassurance. Even though reassurance would come, it's me showing you another way of seeing things.